So good morning, everybody, or good afternoon, I guess. Morning in the West Coast, afternoon here on the East. We have started the recording for the webinar, so we are about to get started. Patrick will be letting people in the waiting room as they come in, and we'll remind everyone to please keep yourselves on mute. And if you are not there, we ask you to go ahead and turn your cameras off. That will help the audio for the meeting, down all the distractions. So if you'll just remember to keep yourselves on mute during the webinar, use the chat box feature to ask questions. We're excited to have you ask questions. And if you're not one of the speakers, we'd ask that you keep your camera off. With that, I will let you go ahead and begin, Shannon.
Thank you, Laura. Good afternoon and welcome to the kickoff event of the Office of Child Care's initiative to improve the social emotional wellness of children, both as a component of quality child care and as part of our COVID-19 pandemic response and recovery effort. Today is a special day for me. I have wanted us to be able to make a serious push for capacity building in child care to support children's social emotional development ever since I held this same position in the Bush administration, and we, along with Head Start, were funding the launch of CEFL, the Center on Social and Emotional Foundations for Early Learning, and hearing deeply moving, totally inspirational stories about how the pyramid model training and implementation, done right and at sufficient scale, was turning around the work lives of early childhood teacher caregivers and the children in their classrooms. The challenging behaviors that lead to expulsion were mostly gone, and teachers could focus on the part of the job they loved best, helping children learn and develop into the little people they needed to be to thrive in school and in life. Over time, CCDF administrators and the rest of the child care early childhood development field have embraced the goal of social emotional learning as part of high quality childcare, and progress has definitely been made. But there hasn't been the funding for a commitment to reach as broadly and deeply as needed. So I'll take a risk here and share my vision. And that is that we take a serious chunk of the additional stimulus money that we, childcare, are likely to get from Congress as part of the COVID-19 pandemic response and recovery next stimulus package, and invest it in training and infrastructure for widespread social emotional capacity building and supports to thoroughly embed this critical quality component into childcare across settings, in centers and family childcare, and across age groups, infant, toddler to school age kids, serving as many children, families, and providers as we possibly can. And if we get it going with the supplemental funding, we can keep it going with CCDF quality dollars and other partner funding later, and emerge from this pandemic with a stronger system to support healthy child development than we had before. So you may be thinking, why social emotional capacity building when we have so many other pressing needs? So I know I've got 400 of you there, but I'm going to read to you a little bit. I want to share some sobering information from a November 24 article in Parenting Magazine entitled, Children of Quarantine: What Does a Year of Isolation and Anxiety Do to a Developing Brain? The article starts out with some quotes from parents taken from questionnaires that the researchers had been putting out. And they were observing toilet-trained children were wetting their beds again, and kids who once went to sleep easily became hard to soothe, waking at night or crawling in with their parents. My son is suddenly scared of everything, one Ohio parent wrote in the first week of June. An Arizona parent corroborated, our 2-year-old has had a very sudden increase in separation anxiety. She doesn't like it when we leave the room, and at night she takes a long time to fall asleep because she doesn't want us to go. By summer, the cabin fever and separation from friends, as well as the disruption of routine, were taking a toll. And at 12 weeks, 79% of parents of kids under 5 said their children were more fussy and defiant than before. And 41% of their children were more fearful and anxious. Harried parents reported frequent tantrums and incessant escalating sibling fights. The trend line showed that fear and anxiety was kind of around 40 to 53%, going up and down during the time period of these surveys, but the number of kids who were fussy or defiant never fell below 70%. After a few more stories, the author goes on to talk about the difference in perspectives between parents and psychology researchers, with the parents often expressing their concerns for the kids in terms of external forces, like the closing of schools, absence of friends, and all of that, while the researchers were looking at the environments in which the kids live, in particular at the parents and how well they were able to protect their children from what was going on outside. What kind of supports did they have in place? So the authors continue to worry about the portion of America's 20 million kids under 5 and whether parents are too tapped out and stressed to actually nurture. And he talks about the decades of research we have that show the presence of a responsive caregiver, especially during early childhood when the brain is plastic, is crucial in healthy development, and that the stable adult attention is even more important for children growing up in persistent adversity and toxic stress. And that when kids ask and they receive no answer, or when the answer they do receive is inconsistent and unpredictable or cruel, the long-term consequences on development are dire. And they go through a lot of research that talks about this, but they list as an outcome cognitive delays, learning problems, impulsivity or aggression, or a numbness or lack of affect on the other, and on, mentally and physically, short-term and long-term. So those are just the tip of the iceberg, but I thought it made it feel a little bit real. And there is one sort of estimate from extrapolating from previous research. Some Harvard professors all listed in here guess that even in the pandemic, about half the kids will do just fine. Another 20% will have high systems of distress that recede over time. But in 15 to 30% of kids, the systems will persist. And that means that with this scale of pandemic, as many as 22 million children could bear scars into adulthood. And they go on and on about what that might look like. So this is a good article. I don't think it's the only one, but at least it's recent. And there's another set of justifications that are sort of coming out of Jack Shonkoff and his team's work at Harvard Center on the Developing Child. And they've recently been posting new material that focuses on the deep interconnection between health and learning in the human body, starting before birth. So we know what healthcare costs. We know what those long-term diseases cost the nation. And we know health costs are crowding out a lot of the programs we wish we could spend money on. So I think that will help us argue for investment in social emotional development and supports. So what we can do to support these conditions and environments in which children develop in order to positively affect lifelong health as well as educational achievement is a lot of what Shonkoff talks about. And his work suggests policies, programs, and strategies that aim at 1, strengthening responsive relationships that build a foundation for social emotional development, school readiness, future learning, along with physical and mental health. 2nd, reducing stress, poor nutrition, and toxic environmental exposures during pregnancy, because that even carries through into childhood and on. And 3, the policies that reduce persistently adverse environments that can lead to chronic inflammatory conditions that last a lifetime. So obviously, Shonkoff addresses way more than the role of childcare, early learning, school-age care, but we are part of that puzzle, and we can have a positive impact. But we need to think big. Increased training of the workforce is essential. But we know in 2018, there were as many licensed childcare centers and family childcare homes as fast food restaurants in the United States. This is not an easy reach. The 2019 National Survey on Early Care and Education that we help fund through one of our offices, OPRE, shows that close to 52% of center-based teachers and caregivers working with children birth through age 5, 52% not yet in kindergarten, do not have a college degree, either an AA or BA or higher. And 47% do not have either a CDA or a state certification to work with young children. And those are stats on the center workforce. The family child care providers, licensed and exempt, aren't even in these statistics. And we also saw that between the 2012 and 2019 surveys, there was actually a decrease in the percentage of workers with a BA or higher. And this is despite a significant increase in the size of the center-based workforce from 1 million to 1.3 million. So to scale up training, we must find, adopt, and expand professional development strategies that meet people where they are. We must be bold. We must find additional effective training pathways, competency-based, that don't rely predominantly on academic degrees. And fortunately, the CCDF block grants include minimum percentages, not just for direct services, but also on activities, spending on activities that improve quality. The money we got in the CARES Act to address the impacts of COVID on childcare, a lot of that could be spent this way. We know that there's another bill currently being debated, another stimulus package that includes additional funding for childcare. So if there's agreement on a bill and it's signed by the president, it's very likely that CCDF administrators, you and yours, will be responsible for distributing additional dollars much more broadly than in the traditional subsidy and quality investment program, with goals as in CARES Act, with goals that include stabilizing the childcare market and ensuring that progress made toward increasing the supply and quality over the years is not lost. It's a tall order, but I do believe that we can together do things that support social emotional capacity building while also supporting the other pressing needs that are coming out of this pandemic and beyond. And I truly believe we can end up in a stronger place than we were before. And Andrew Williams from our team will be talking a little bit about the use of the funds. Even though that bill still hasn't passed, we can tell you something. And then the whole program today is designed to help you see what's possible. And then we can start to provide the technical assistance and details and whatever you need to actually go down this pathway. So at this point, I shall turn it back over to whoever it's supposed to go to. Is it Laura?
Absolutely. Thank you so much.
Okay.
Very good. So thank you for that, for inspiring us as we continue to do our work. It's my pleasure to introduce all the panelists on today's webinar. Jean Van Oresdahl from the National Center on Early Childhood Quality Assurance. Rana Schaefer, who's here from the Child Care State Capacity Building Center. She oversees the Infant Toddler Specialist Network. Lisa Fox from the National Center for Pyramid Model Innovation. Melody Bird Post, who I don't see in our screen yet, but maybe she'll take herself. There you go, Melody, from the National Center on Tribal Child Care Development. Katari Coleman is here. She's from the National Center on Afterschool and Summer Enrichment. I don't see you yet, Katari, but if you could just give us a wave. Want to welcome Neil Horan from the Center of Excellence for Infant and Early Childhood Mental Health Consultation. And then, as Shannon mentioned, Andrew Williams is here to really help us think about expenditures of quality dollars, allowable expenditures, and then what might be on the horizon for all of us if new money is released. So huge thanks to the panel for sharing your wisdom. So I do want to say a little bit about the agenda. Agenda was really designed to support you as you consider what is possible for your state, your territory, or your tribe related to meaningful integration, strategies to support the child care workforce. The workforce is really working tirelessly right now to support the social emotional wellness of children in a mixed delivery system, in family child care homes, in child care centers, large and small. So how do we support each of those people helping our young children? It's our hope that you will be able to identify a strategy based on the multiple strategies we're going to present to you right now, and that you might want to explore some of these strategies and think about what you might want to implement in your state, territory, or tribe. Or maybe you'll see a strategy that you're already implementing and you'll wonder how you could scale up to serve more children. This agenda and the whole webinar is really just a launching point, though, as Shannon said. We know that the real work begins after this particular call. So please know that the technical assistance is available for each and every one of you, so that you can design an integrated system that works for you in whatever jurisdiction you're working in. We really are going to set up some group technical assistance activities like communities of practice to support you, but we're also ready and willing to support your individualized needs and to customize supports as you consider how to roll out certain initiatives. At the end of the webinar, I'm going to talk a little bit about new resources that will be released next week to provide you with additional information on each of the strategies talked about today. And then we hope that you'll share with us how we can be of assistance to you. So I want to get started with the presentation. So let's think about why this, why now? I mean, as Shannon said, we are all seeing the effects of the pandemic on the social emotional wellness of children. They're having changes in their routines. We're seeing some long-term psychological effects really related to feelings of loss and feelings of control about their routines, about their family members' ability to be around them, isolation, friends and extended families. We're seeing people being affected by the loss of their family members. We're seeing access to health, community, and social supports being diminished due to the pandemic. And we're also seeing that children are really affected by the increased stress that is part of their caregivers and their families' daily lives. There's no doubt that financial insecurity, food insecurity, and tensions in relationships are high during the pandemic. So we're seeing a lot of indicators of trauma and stress and loss. Certainly as you think about infants and toddlers in care, we're seeing eating and sleeping disturbances, we're seeing irritability, and it's harder for us to soothe children. We're seeing developmental milestone delays. We're seeing defiant or possibly aggressive behavior in young children. For our preschoolers, we're seeing some regression in some skills they had already picked up. We're seeing, again, sleep disturbances. We're seeing this possibility of engagement in some traumatic play. We're seeing a decrease in their social skills. And we're also seeing this hypervigilance, this kind of always ready to react very quickly in those preschoolers. And we're also seeing these indicators in our school agers, which Katari is going to talk about some great strategies to support school age. And we're seeing them in the adults. And remember, these are the adults who are working with young children as well as the family members. So it's difficult to be attentive and to maintain attention. We're seeing mood swings in our school agers. We're seeing some aggressive behaviors. Perhaps we're seeing some children, young children who are asking to be left alone. Or they're having some physiological effects, headaches, stomach aches, or regressive behaviors. And again, with adults, family members, and adults caring for young children, it's difficult to be responsive when you have a lot of stress going on in your lives. And we're seeing some real increased chance of social risk factors, mental health risk factors, substance abuse, and intimate partner violence. So there are certainly some ways that we can support children and ways that we can support our professional development system and our workforce in helping us be more reactive or better reactive to young children. So again, there are these ideas of helping our workforce understand attachment theory and the importance of routines for young children, making sure that our workforce understands emotional literacy, how to read children's emotions, how to validate young children's feelings. How can we support our workforce in understanding the huge positive aspects of the continuity of care? And how can we always make sure our workforce is culturally and linguistically responsive to the young children that they serve? And this webinar is really going to stress how we can utilize a lot of really engaging strategies to support our workforce as they support the social emotional wellness of young children. So I want to do a quick couple poll questions just to get some information from everybody on the call today. So this first poll question is your state or territory or tribe currently implementing a social emotional wellness child care initiative to support children, families, and providers? So I think Patrick, pull up that poll and you'll be able to answer that poll. So again, is your state, territory, or tribe currently implementing an initiative that supports children, families, and providers? And the second poll question is your social emotional wellness initiative accessible statewide and available to all providers in your state, regardless of whether they're family child care or center-based, or located in a rural area or an urban area? So I'm going to give us a second to look at this poll. Looks like we've got about half of the people who have answered. I'm going to give it another second here. Okay, let's see where we are. So it looks like many of you, over 51%, are working in a jurisdiction that is providing some initiatives that support children. About 32% of you have an initiative that also supports families. 51% of you are saying yes to an initiative that supports providers. And about 28% are kind of like, not quite yet, we're not there yet. I'm hoping that this webinar will get you there and we'll be able to provide you some technical assistance. And again, about 46% of you are saying that your initiative is available statewide or to all providers. So again, I'm really hoping that some of the strategies you're going to hear about today will help you move the needle to be able to be more accessible to all of your providers. I'm going to get rid of that whole graphic. Very good. So I'd like to turn it over to my colleague, Jean Van Oersdaal at the National Center on Early Childhood Quality Assurance, so that Jean can share some of the common ways that states have been addressing social emotional wellness strategies. So Jean, I will turn it over to you.
Thank you, Laura. And thank you, Laura and Shannon, for really setting the stage for the importance of the social emotional wellness work for young children. This next section of today's webinar highlights strategies many of you are already putting into practice within some of your state systems. This includes strategies that directly support children's social and emotional wellness. Next slide, please. Such as implementing a social and emotional learning program, for example, the Circle of Security or Incredible Years, adopting positive behavior interventions and support frameworks, such as the pyramid model for promoting the social and emotional competence in infants and young children, embedding social and emotional indicators within your quality rating systems, and including social and emotional development within your state early learning guidelines from birth through school age. Next, we turn to strategies that support home-based and center-based childcare. These include increased access to infant early childhood mental health consultation to support early childhood professionals, utilization of child care health consultants to support developmental surveillance or screening in child care settings, and increased access of coaches that can support responsive, relationship-based care. Professional development on the use of social and emotional screening tools, incorporation of social and emotional professional development, which we heard Shannon allude to is so crucial to our initiatives and can be aligned with health and safety training requirements, addressing child development, including the major domains of cognitive, social, emotional, physical development, and approaches to learning. Social emotional training should intentionally support skills that children need to manage their emotions, recognize the emotions of others, things like emotional literacy, emotional regulation, empathy, and perspective taking. And this includes children from infants through school age and embeds supporting skills such as communication skills, social understanding, developing self-confidence, assertiveness, and positive social interaction with peers and adults. Another strategy that states have utilized to support the social emotional wellness of infants and toddlers is the integration of responsive caregiving, relationship-based care training, and professional development. In supporting trauma-responsive training for all child care professionals, for example, the resources that have been developed by the National Center on Afterschool and Summer Enrichment on Adverse Childhood Experiences. A new training for trainers is being developed from the National Center on Early Childhood Quality Assurance and the State Capacity Building Center's Infant Toddler Specialist Network on trauma-responsive caregiving, a framework for resilience in infants and toddlers. This training of trainers will go beyond being informed about trauma and take a deeper dive into how caregivers can use their knowledge of trauma and respond in ways that support the well-being of children, families, and the caregivers themselves. And finally, additional strategies that are being used within states include the creation and adoption of social and emotional toolkits for use by home-based and center-based child care providers, including those providing school-age care. For example, the Afterschool Alliance Social and Emotional Learning Toolkit, identification and alignment of social and emotional measurement strategies across systems and across initiatives, and ensuring core knowledge and core competencies for the early childhood workforce includes a focus on understanding best practices to support social and emotional development. As you can see, there are a lot of things that are already being done, and so I will turn this back to Laura so she can move us forward. Thank you, Laura.
Thanks a lot, Jean. Again, we already have so many great social emotional wellness initiatives embedded in your current early care and education systems. I'm excited to have Rana Schaefer here with us today from the Infant Toddler Specialist Network to talk about one initiative that many states who are on this call have already implemented, and that is the relationship-based care training for trainers. So Rana, I'll turn it over to you.
Thank you, Laura. And thank you everyone for setting the stage about why this is so important. And I am delighted to be able to highlight this training for trainers. So we know that research has shown that relationships are at the heart of social emotional wellness, especially for infants and toddlers. So with this in mind, the Infant Toddler Specialist Network and our partners at West Ed developed the relationship-based care training for trainers, which is based on the Program for Infant Toddler Care's 6 essential program practices. This training was developed a few years ago, and in the spirit of continuous quality improvement, we've refreshed it this past year in 2020, and we've modified it for a virtual platform. As Laura just said, many of you have already brought this training for trainers into your jurisdictions, but for those of you who haven't, I'd like to tell you a little bit about this opportunity. The training for trainers can either be presented in person, soon we really hope, or virtually. It is a 15-hour training either way. For virtual, it can be split into 7 2-hour trainings with a 1-hour introduction, or it can be brought to your state, territory, or tribe in a 2-day in-person training. It also can be customized and adapted to really fit your needs. The audience for this is generally infant toddler leads, infant toddler specialists, or other training and technical assistant specialists, staff from family child care networks, and CCRNRs, as well as center directors and administrators. We've even had some state administrators, some licensing staff, and some staff from some institutes of higher ed have attended this training in states in the past. Trainers who attend all sessions receive not only a certificate of completion, but all the materials that they would need to train infant toddler child care staff, family child care providers, home-based providers in their jurisdictions. In addition, participants of the Training for Trainers will have the opportunity to be part of a community of practice to support their use of materials. A little bit later, Andrew will describe how CCDF funding can be used to support this training. So as a result of participation in the TFT, we expect that participants will deepen their understanding of how to support infant toddler development, will have an opportunity to really explore the Program for Infant Toddler Care's 6 essential program practices, and have many opportunities to consider approaches to training and technical assistance, and will receive support that is needed for implementation. It's not enough just to come to the training, but we at the Infant Toddler Specialist Network believe ongoing support is the key to changing practice. Next slide, please, Laura. Thank you. So the essence of this training is exemplified by this wonderful quote from Donald Winnicott. Since infant toddler development and learning exists through relationships, and we know research has shown that high quality infant toddler care is built on relationships with caregivers, families, and peers. Next slide, please. I just wanted to very quickly show you what the 6 program practices are. I'm not going to go into details on the descriptions of each of them. Just know that each practice builds on the rest and is best when implemented together. The Training for Trainer includes information about each of these practices from the state, the program, and the classroom or family child care home implementation perspective. And the final slide I have is sort of a summary that the 6 essential practices of relationship-based care provide a framework that supports responsive caregiving, which is at the heart of social emotional wellness. The practices create an opportunity for responsive interactions, and we also know that it's not the practices that make relationship-based care, it's the people. So there's ongoing support for the people that attend this training, both at the Training for Trainer levels and at the child in arms level as well. A little bit later in this webinar, as Laura promised, she'll let you know how you can request this training for your jurisdiction. So thank you, Laura. I'll turn it back to you.
Thank you, Rana. One of the really fascinating things about this particular initiative is states have worked with the Infant Toddler Specialist Network to get their professional development system and their infant toddler specialists all trained to deliver this. They are able to get into the field, literally into the trenches with family child care providers and center-based providers, and really help them understand how to create an environment for infants and toddlers that helps them thrive. And again, building the capacity of our workforce is so important. So thank you for sharing that, Ron. I really appreciate it.
My pleasure.
So I'm going to turn it over now to Lisa Fox. Lisa Fox is at the National Center for Pyramid Model Innovations. As I was watching people sign in today, Lisa, I was so excited to see how many people represent pyramid states. So we have a lot of people who are already committed to the pyramid model and how it can be so supportive of the early care education and child care workforce. So I'm excited for you to go a deeper dive with states who might not be as familiar. And then following Lisa, I'm going to be really excited to have Melody Redbird Post talk about how she has used your model with a tribe, and other tribes have adopted this model. So Lisa, I'm going to turn it over to you.
Lisa, you're muted.
Thanks, Laura. Sorry about that. You can advance the slide to the next one. If you'll advance one more slide, that'd be great. There we go. So there's my friend Isabel, and she wants to know what's this on the table, and that's the pyramid model. And I'm here to talk more about that. As we all know, the pyramid model can be part of the solution, I think, of addressing all of these concerns. I'm not going to repeat what Shannon so eloquently shared with us, as well as the other information that was shared. But We do know that the early years are prime time for addressing social emotional wellness for young children and addressing some of the challenges that we face. And I think the pyramid model can be a robust solution for some of these issues. So what I want to do is explain a little bit where the pyramid model came from, how we view it, and then move on to what we've learned over the 18 years that we've been able to implement the pyramid model, and finish off with some ideas for next steps that you can engage in the pyramid model work. So you can go to the next slide. So the pyramid model was developed by 2 national TA centers, and we are so grateful for that really important funding from Child Care and Head Start that funded the Center on the Social Emotional Foundations for Early Learning, as well as the Office of Special Ed Programs that had a vested interest in making sure that all of the environments where young children with disabilities are environments that will promote those children's social emotional skills and address challenging behavior. You can go to the next slide. I think we started this work about 2001, and you probably recognize many of these faculty. We have Neil Horn actually later in this webinar, who was one of our core faculty in the development of it. I think this slide's animated if you'll move the slide to the animation. So one of the things you might know is we were really intentional and purposeful about having diverse representation in the development of the pyramid model. And that is so that we could make sure that we were promoting social emotional development, that we had practices to address intervention for children who had more intense needs, that we were thinking about the inclusion of children with disabilities, and that we were thinking about implementation science and the design of the pyramid so it would be sustainable. You can go to the next slide. So here's where the current complete body of work is now housed at the National Center for Pyramid Model Innovations. This is a TA center funded by the Office of Special Ed Programs, of which I'm the principal investigator. And so you can see by this graphic that everything pyramid model that we've developed is housed here for easy access from you. So if you go to the next slide. So I think a lot of you are familiar with the pyramid model, but I want to describe pretty quickly what it was, what we built, and how to think about it as we engage in this work across states and programs. You can move to the next slide. So we think about the pyramid model as being inspired by a public health framework. So it has multiple tiers. It is a framework of evidence-based practices that includes promotion practices for all children to promote social emotional competence. At the middle tier, we think about prevention practices for some children who need more intensive social emotional intervention. And at the top of the pyramid, we have the practices for children who have really severe social emotional delays or persistent challenging behavior. And so this is a framework of practices. It's not about curriculum or a particular intervention, but it's a framework that might house curricula and intervention that are evidence-based and aligned with those practices. You can go to the next slide. Over the years, the pyramid model work has developed materials and practices and guides that are relevant to infants and toddlers in early intervention, as well as within classroom programs. There are parent training materials and parent training resources. We have many demonstrations of implementation in family childcare homes, as well as in preschool programs, Head Start programs, and public school programs. And so there really, it has wide applicability. So again, it's the framework of practices, and then we articulate those practices based on the application to a particular population or a particular setting. You can move to the next slide. So the universal level, those are practices to promote the social emotional competence of all children, are nurturing responsive relationships and high quality environments. And one of the things to notice in this slide is the pyramid's resting on effective workforce. And so that's of particular importance, this idea of practices that we bring to support staff to be able to feel both confident and competent in their ability to promote children's social emotional wellness and social emotional skill development. You can move to the next slide. So the foundation is relationships, and it is all about relationships, right? We have to start there. We think about relationships in three ways. We think about the relationships between children, the relationships between staff and families, and the relationships between staff and children. And I think this is particularly relevant as we think about children exposed to trauma. You can't overemphasize the importance of relationship, but also when we're talking about trauma, we're talking about a family system, right, that's been exposed to trauma. And our relationship with families and their children are really key to fostering child resilience and recovery. You can move to the next slide. So the relationships level is paired with supportive environments. And in supportive environments, we're really pulling out the practices that offer preventions for children, preventions of challenging behavior, but as well promotion of social emotional competencies. And so we design the environment with practices so that routines and activities have ample opportunity for children to build relationships with each other, for adults to build relationships with children, and for children to have a lot of time to engage in social learning opportunities. You can move to the next slide. At the next level of the pyramid, we're thinking about one, really revving up robust social emotional learning for all children, but being ready to support children who might struggle with social emotional support needs. And that's kind of our middle tier of the pyramid model. You can move to the next slide. And those areas of social emotional skills, and these are the domains that commonly appear across all evidence-based social emotional early learning curricula. So they include practices for teaching children friendship skills, which are peer interaction skills and interactions with adults, emotional literacy, the ability to express emotions appropriately, understand the emotions of others, self-regulation, the ability to manage strong emotions and to regulate behavior, and then to engage in social problem solving. So our goal is for practitioners to have the capacity to be able to teach all of these things to children and meet all of their diverse needs in these key areas, social emotional learning domains. And then if you go to the next slide, and then at the tertiary intervention, and again, for the few number of children who enroll in our programs and enroll in our centers who might have very significant social emotional learning delays or persistent challenging behavior, it's the design of individualized interventions for those children. So you can go to the next slide. I think this is really critically important. I think that providers and teachers need to know that there's a process we're going to use when we encounter children like that, that all have the capacity to support that child, that there's a way that we can engage with families in developing a plan so that these children's needs can be addressed. I think that's really key to our ability to continue to support these children, and really key to not using exclusionary discipline in response to problem behavior. And then in the next slide. So I think it's also really important to say that the pyramid model is about ensuring that effective workforce and making sure that providers and teachers who are using these practices are able to implement them with fidelity. And when they do, what we've seen is that teachers feel more connected. They feel more connected to the children and families that they support. They feel more confident about their ability to guide and help children. And they're more able to implement evidence-based practices. So you can move to the next slide. So here's what we've learned. You can move to the next slide. Over these 18 years of implementing the pyramid model, and it's not just what I've learned, it's what collectively across the country people have learned in this work. First of all, I think we've all learned in early childhood, training alone is completely inadequate for moving people and moving the needle of practices. Coaching is going to be necessary. And when we do that coaching, the focus is the fidelity of implementation of practices. But in order to put all of that in place, we have to engage in systems change and administrative support so that implementation can happen. And of course, we want to use data decision-making in that model. You can move to the next slide. We have done randomized studies, and these are citations for the 2 classroom randomized studies, but there also is a randomized study looking at infant toddler classroom implementation. I believe it was in kindergarten settings, as well as implementation in childcare programs. But if you go to the next slide, what we've learned from the 2 randomized trials that I was involved in that were implemented in classroom programs, we saw that for kids with challenging behavior, that there was a reduction of their challenging behavior, and that teachers noted improvement in their social emotional skills. We also observed improvement in their social interaction skills. So we know the pyramid model really works for children with challenging behavior. But we also saw that all the children in the classroom were rated as having improved social emotional skills, and that children in the experimental group that received the pyramid model were this was noted with significant difference in children in those in the control condition. If you go to the next slide. But we also know from program reported outcomes, and there are 32 states that have some kind of initiative around implementing the pyramid model, and they report to us those improvements of classroom quality, the more intentional instruction on social emotional skills, the elimination in the use of exclusionary discipline, and decrease in problem behavior. And this is for our family childcare programs, as well as our childcare, public pre-K, and Head Start programs. You can move to the next slide. So where are we now? You can move to the next slide. So where we are now is, first of all, we're very mindful about the critical importance of implementation science to be able to implement and scale this. And I think looking back, the longevity of the pyramid model and the success we've had in bringing it to programs is really about that journey, right? The implementation journey, and being thoughtful about it and giving the time to get it there. Key to implementation are implementation teams. Key to implementation is being able to nurture the buy-in of staff, and also making sure there's some amount of readiness for going into an endeavor of implementing something that really is a complete change in practice and orientation around how we support children who have social emotional learning needs and problem behavior. You go to the next slide. So in our work now in the TA Center, we think about establishing these 3 things, and then each of those use data for decision making. And so we've worked to establish cross-sector state leadership teams. That's very important, that we're thinking about all of the sectors of early childhood services in order to reach all of the children. That leadership team then establishes a professional development network of implementation coaches or program coaches. These coaches are coaching the program to implement the model. And so it's coaching at a different kind of layer than the practices coaching that happen within a program. Then we want states to identify the implementation at a program level. So we're going for program-wide implementation. And of course, this application, these implementation programs can be as small as a family childcare program, or a large center-based program, or an LEA that's implementing this in a school district. You can move to the next slide. So here's a picture of kind of what that looks like, a cross-sector leadership team that guides or establishes a professional development network of program coaches. And of course, that could occur within sectors based on funding, or be across multiple sectors. And then we have our implementation sites, and those implementation sites are guided by leadership teams that say, we're going to do the pyramid model. And they support practitioners who then support families and children. You can go to the next slide. So I think this idea of a program-wide implementation that's guided by a leadership team is pretty unique, and it's been very successful. So at the program level, a leadership team is established to really think about what's the implementation infrastructure that needs to be in place so our teachers or our providers can do the pyramid model practices. So here in Tampa, where I live, my friend Mary owns and operates Merry-Go-Round Childcare Program. And Merry-Go-Round Childcare, in that, she's the director, and her husband, who's the assistant director, and 2 teachers are the leadership team. And they think about, what are all of our pieces? How do we make sure we have staff buy-in? How do we communicate to families that we're doing this and work with families? How do we make sure that when kids need more, that teachers are able to access support to figure out what that is? How do we coach our teachers and use data for decision making? You can go to the next slide. So these are the kinds of things, kind of in text and not in the picture, that leadership team, so that Mary, her husband, and the 2 teachers meet about monthly, discuss, and make sure that their implementation can be supported and that teachers are fully supported or providers are fully supported. If you move to the next slide. So now it's training and not only practices, but we have to train teams to be able to function. And so we train leadership teams specifically in that implementation process, the use of data decision-making, training coaches to use practice-based coaching that's focused on the implementation of those practices, and then using tools that help them understand where teachers are and how to move those practices, as well as training in that behavior intervention planning. You can move to the next slide. In the last several years, in addition to those things that we've been thinking about, we've also been working on helping states and programs think about these things. So we've developed some tools and guidance around addressing equity and other features of this. We've worked closely with our colleagues who do infant and early childhood mental health consultation to figure out the intersection of that with the pyramid model. And so I hope you'll go to our website, where there's some really nice resources as well as discussions about each of these things. So let's go to the next slide and talk about getting started and what you might do. On the next slide. So first of all, we're going to send these guides, and we'll be talking about that in a little bit. And in it, there is a map that shows you where many states are who have a statewide initiative in pyramid model. So if you are in a state and there's a state lead that you're not connected to, reach out and join the HAT cross-sector team. They would be very excited to have childcare leaders join that team to think about building the capacity of providers and programs and technical assistance providers to be able to support the pyramid model. So if you're in a state where they have some state work and you're not on the cross-sector team, give them a call and get there and join that team to be able to work on that. I'm sure they'll be super eager for that. You can go to the next slide. Another strategy is to integrate pyramid model work into your current professional development and quality initiatives. And we talked about that earlier in the call, and many states have done that already. If you haven't done that, that may be a really great place to start, where we could offer training to practitioners and programs in those pyramid model practices. The other place to think about is what does your coaching look like, and can we provide practice-based coaching around the pyramid model practices to strengthen implementation fidelity. There are some online pyramid modules offered by the Pyramid Model Consortium. That might be a really quick way to get many providers some access to training, but in many states, they've also created their own materials around training pyramid practices and integrated that into some of their training systems. You can go to the next slide. I know you're thinking about the money. Statewide efforts, for those of you who haven't done pyramid work, this is what other states have done. They've used their Child Care and Development Fund dollars. They've used Title I. Some states have been able to get initiatives funded through early childhood mental health. There are quite a few states that use launch dollars at one point to start their work. State preschool dollars can also be used. IDEA 619 funding can be come to the table and contribute to a cross-sector initiative. And we have seen a lot of success both with foundations and some success with legislative allocations for this kind of work. So you can go to my next slide. Again, visit us on challengingbehavior.org if you want to learn more. There are really a lot of resources that you could explore this more. And on the next slide, there is an organization, a nonprofit, the Pyramid Model Consortium, that was established so that states could get training and technical assistance for a fee-for-service basis. So that is all I have to share about the pyramid model. Thank you.
Thank you so much. I tell you, I was taking diligent notes, even though I've seen this presentation so much this week. I love that you talk about the foundation and the effective workforce as the foundation. I think everyone on this call understands the critical importance of an effective workforce to support the holistic development of young children, including their social wellness. And this idea of making sure that our workforce is connected, confident, and competent, you said. I think that's really powerful. All of the initiatives that we're talking about, these strategies we're talking about on today's call, really do reinforce a more connected workforce, a more confident workforce, and a more competent workforce, which translates into young children who feel confident themselves and are able to deal with their own emotions and self-regulate. So it's really important. And I don't know if everybody caught it, but at least 32 states are already in this game at different operating levels of the game. So you're not alone if you decide you want to jump into the pyramid model. We can connect you with other states and we can build some communities of practice so that states who are, oh man, they're really rocking and rolling with the pyramid model, can support states who are thinking about embedding some professional development. And Lisa, I had a blast going through your website and looking at all the free resources. They're super accessible, everybody. And those free online trainings also really accessible. And just think about how you could maybe add them to your required health and safety trainings as just a step into it. So thank you, Lisa. And we all look forward to working with you as you support us with the pyramid model. So I think one thing that's really important is that we talk about how these things are applied in practice. And so I was really excited that Melody was able to join us. Melody, I'm going to switch over to your slide. So Melody Redbird Post is here from the National Center on Tribal Early Childhood Development. And Melody's going to talk about what it actually looks like when you decide to adopt a model and you move it into practice. So Melody, I'd love to turn it over to you.
Thank you so much, Laura. Deon de Batsan, thank you so much to all of you for joining us for this webinar. And we'll go to the next slide. So as you've heard, as Lisa just described and as Laura mentioned, so the program-wide implementation of evidence-based behavior support programs like the tiered pyramid model can be very powerful tools in addressing children's challenging behaviors, and also can be another pathway to building the resilience of the children that you serve through your programs. And just wanted to mention that when we think about tribal lead agencies and tribal childcare, and really take a minute to think about what do some of these initiatives look like in tribal childcare programs. I just wanted to mention briefly that social emotional supports for childcare providers can be funded through CCDF quality dollars if they're identified as a quality activity in the tribal CCDF plan, and I know that Andrew is going to be speaking more about that. And also just wanted to mention that any of the social emotional wellness supports that you're hearing about today for tribal lead agencies, you can use those with all provider types in all different provider settings, even your tribally operated centers if you have them. And these models really provide a framework for your teachers and your providers to work with families. And I wanted to kind of speak a little bit about one particular experience. So I just wanted to share a little bit about a personal experience. So we've seen that the pyramid model has been used by different tribal CCDF programs over the years, and as the resources have evolved, so has the opportunity to use the pyramid model as a program-wide initiative as a part of an overall comprehensive strategy to support social emotional development for tribal children and families. And the pyramid model in particular can be used if a tribal lead agency operates a certificate program or offers grants and contracts for slots, or as I mentioned, through tribally operated centers. And really wanted to also mention that these initiatives can really enhance your professional development initiatives and can also include coaching and mentoring, training for trainers, and mental health consultation for your childcare staff and providers to support these. And just also wanted to share that recent research has affirmed that our tribal cultures and tribal languages are resiliency for our tribal children and their families. And much of the recent evidence points to the fact that when Indigenous children are provided opportunities for participating in their tribal language and culture, their social emotional wellness and their resilience are strengthened. And when I was a tribal CCDF administrator for a tribe with a medium allocation size, we did have a tribally operated center, and in that tribally operated center, we worked together to implement a Kiowa language immersion program for our infants, toddlers, preschoolers, all the way up through our school age, through 10 years old. And we supported that initiative through CCDF quality funds. However, we had quite a few children with challenging behaviors, especially infants, toddlers, and preschoolers. So in doing some research and exploring, I stumbled upon the pyramid model and decided to implement the pyramid model in my tribally operated center. And this was back when the pyramid model, when Lisa was talking about all of the research, well, this was back when the resources were still in the research phases. And as they went through the process that Lisa described, those resources were published on the website. And so I had found those resources and started using them with our center director and our staff in our center, as well as with our families. And just wanted to share that this took time, right? It took 3 years to implement fully. So it really was, a lot of time and effort to develop this initiative. However, we developed and used the pyramid model in conjunction with our tribal language immersion program that we had going at the same time. So we actually embedded the pyramid model strategies and supports into each of our classrooms and actually through our Kiowa language. And so we would use some of the social scripts and the different resources that the pyramid model has, as well as all the environmental print. We translated those into our language, and we shared resources with families. And so I just wanted to share that it is possible to really support, if you do see challenging behaviors in your program, it is possible to implement the pyramid model, even as you operate tribal language immersion socialization programs.
How would I help them?
I'm hearing some background noise. Okay. And I just wanted to share that by implementing the pyramid model, especially the trainings, which are just wonderful modules, packaged modules for the teaching staff. Through our immersion program, we actually, over the time period of 3 years, we saw a dramatic decrease in challenging behaviors and an increase in family-teacher communication, and really saw the children's their social emotional development really start soaring as the challenging behaviors decrease. So I just wanted to share that we do know that over this past year, this has been such a challenging, unprecedented time. And unfortunately, the pandemic has really highlighted many areas of need for our tribal communities and our children, families, and providers that tribal lead agencies serve. And just wanted to share that by approaching the challenge of this pandemic, which might be bringing up some historical trauma as well, by approaching this challenge through the lens of resilience and through taking a trauma responsive approach to providing childcare, your program staff, providers, and families can really be equipped to thrive and to really strengthen their resilience despite all of these challenges. Just wanted to mention briefly that as a follow-up, the National Center on Tribal Early Childhood Development looks forward to offering various training and technical assistance opportunities over the next few months to tribes who express interest in working to develop a comprehensive social emotional wellness initiative. One opportunity is a tribal-specific training for trainers on trauma-responsive care, a framework for resilience. So be on the lookout for additional information to follow. Really appreciate your time, and I'm going to turn it back over to Laura. Aho.
Thank you so much, Melody. You know, when Shannon brought all of us together and challenged us to create an initiative that would support states, territories, and tribes, she constantly reminded us we must be individualized in our approach, and we must be able to meet states, territories, and tribes where they are. And so, Melody, we were really excited that you were able to share one of your experiences with implementing, so that people could picture themselves in implementing this program. So now we're going to take another view and think about what this initiative, the Pyramid Model Initiative specifically, looks like when implemented with a school age focus. And it's really important that we think about, when we think about childcare, most of us go, oh, birth to age 5. But our next speaker is going to remind us that our school agers who are now doing remote learning are really struggling right now and need all of our attention. So Katari, I'm excited to have you join us and talk about some of the ways you're seeing school age programs support the social emotional wellness of their school agers.
Thank you, Laura. As a representative of the National Center on Afterschool and Summer Enrichment, I am excited to share some models used in out-of-school time environments to supply and encourage social and emotional wellness in school-age children. And like my colleagues, I just want to mention that I am grateful that Shannon Christian and the Office of Child Care launched this critical initiative. Next slide, please. So I'm going to get started. The first is Positive Behavior Intervention and Supports, better known as PBIS. The pyramid model, which was just discussed by Lisa and Melody, provides the framework of practices for the implementation of PBIS within early childhood and school-age classrooms and programs. During the implementation of PBIS, the pyramid model is often used to guide the implementation of promotion, prevention, and intervention practices. This is why the pyramid model is often referenced as the early childhood PBIS. Like the pyramid model, the practices are based on teaching and modeling proper behaviors, requires clearly defined expectations and goals through lessons that are created to teach and model expected behaviors, and the use of data that is collected through the tiers, which identify behavior, learning needs, and trends. This is done in an effort to be responsive and proactive. Many schools and programs use PBIS along with other supports. For example, Oregon ASK, that's Oregon ASK, After School, which stands for After School and Summer for Kids Network, developed a PBIS and After School handbook. Like the pyramid model, PBIS implementation is possible across childcare environments, inclusive of family childcare and family, friends, and neighbor settings. Next slide, please. Second, there is the CASTLE framework. CASTLE here stands for the Collaborative for Academic, Social, and Emotional Learning, which is applied across many school and OST environments. The CASEL SEL framework addresses 5 broad, interrelated areas of competence: self-awareness, self-management, social awareness, relationship skills, and responsible decision-making. It can be taught and applied at various developmental stages and across diverse cultural contexts to articulate what children should know and be able to do for academic success, school, and civic engagement, and health and wellness, including social and emotional wellness. The effectiveness of the CASEL SEL framework has been substantiated with evidence in school and after-school settings. Examples can be found across schools and OST programs in states like Delaware and California. And again, implementation is possible across all childcare environment settings. Next slide, please. And lastly here, positive youth development principles, we know as PYD, is an intentional pro-social approach. It engages youth within their communities, schools, organizations, peer groups, and families, recognizes, utilizes, and enhances young people's strengths. It fosters positive relationships and furnishes support needed to build on their leadership strengths. The principles are: 1, to focus on strengths and positive outcomes; 2, youth and voice engagement; 3, strategies that involve all youth; 4, community involvement and collaboration; and 5, long-term commitment to their needs. This framework illustrates that to achieve the vision of healthy, productive, and engaged youth, PYD programs, practices, and policies must work with youth to improve their, as you see in the slide, their assets. And so these are necessary resources, skills, and competencies to achieve desired outcomes, their agency, the ability to act or intervene on their own behalf to set and meet their goals, contribution, to engage youth as a source of change for their own and their community's positive development, and of course, enabling environment. So they need to be surrounded by an environment that develops and supports their assets, agency, and other needed skills and resources. U4Youth's online professional learning and technical assistance platform for 21st century community learning centers, which is out of school time programs, promotes positive youth development as a model for programs. And again, implementation is possible across out of school time childcare environments. These 3 models, along with other strategies such as trauma-informed practices, as mentioned earlier, healing-centered engagement, and other relationship-based interventions are models to empower childcare providers, to empower school-aged children with regards to their social and emotional wellness. It is important to note that our center, NCASE, for the National Center on Afterschool and Summer Enrichment, created several resources like briefs that highlight various models and concepts. And there will be new resources and activities in the new year. I want to say it is very important. I want to say here it's very important to include the school-age population and their providers, the out-of-school time workforce, when implementing a social and emotional wellness initiative, especially now with some of the changes and just the changes and the stress around the whole movement to remote learning or hybrid learning with regards to the pandemic. And I will say thank you and turn this right back over to you, Laura.
Thank you so much, Katari, for reminding us about those important school agers who are really also struggling during this pandemic. And again, this theme that keeps threading through all of these presentations is, how is it possible for you as a state, territory, or tribe to either expand your implementation of an existing initiative or begin to adopt an initiative? And whatever entry point you're at, whether it's a school age strategy or an infant toddler strategy, we hope you're learning some new information. And again, I'll talk about our resource guide in a moment, but a lot of the information that you're hearing today will be available to you in some small resource briefs. So I'm really excited now to present another strategy for everyone and introduce Neil Horan, who's from the Center of Excellence for Infant and Early Childhood Mental Health Consultation. And Neil is going to share a little bit about the implementation of infant early childhood mental health consultation. A lot of states on the line who are implementing this very beautifully. So Neil, I will turn it over to you.
Well, thanks, Laura. I know that people have been sitting here saying, gosh, I hope there's just one more person from one more center to just keep talking. Well, you're in luck, folks. Here I am. I feel like I'm on an episode of Shark Tank and I'm the last person in after Under Armour and iPods have gone, but I'll do my best and I'll move us along. But I do think that, as I thought about this, I always like to start with this. Shannon had said to me, you better talk about all the different kinds of childcare. Not a problem. I had 3 kids in 16 months. My older children are a 21-year-old and twin 20-year-olds, and I have a 5-year-old as of tomorrow. I've had those kids in CenterBased, family childcare, FFF, you name it, my kids have been there. And so I think that it's important to understand that when we talk about mental health consultation, there's a couple things to emphasize. One is it's got to be available to all providers. And I think that this is a great opportunity. The beauty of being on Shark Tank right now is that we're in a pandemic, which has shown everybody how important mental health is and how important it is to support the children and their families, but also the staff. So I've been on calls with folks, family childcare providers over the last few months. I've been doing like a little group for them, talking to them about their stress, which now everybody understands the stress that's involved in providing care to young children and their families. And mental health consultation, quite frankly, is one of the kinds of things that can be critical, not just now during a pandemic, but just sort of ongoing. I'm not going to give you more statistics because you've probably seen these before, but when I think about this work, I'm reminded of Miss Lillian in Colorado, who was a family childcare provider and said to me, I can't afford to have children be expelled from my care because it's my income. And so I depend on this mental health consultant who's coming in with great mental health expertise and background. It's not just anybody, it's a person with mental health expertise, but that person is part of my business plan. And so I think when we come to understand that children who are being expelled from early care and education, from childcare at much higher rates than they are from K-12, we've got to do something because we also know what the sort of outcomes are for those children who have those early negative experiences like that. So next slide. We also know that mental health consultation is what's going to address equity and disparities. And I know Lisa talked about it, but this is really where we have found what mental health consultation's power is we know that there is such disproportionality in terms of who's being suspended and expelled from childcare that 42% of those children suspended are Black boys, yet they only represent 18% of all preschoolers. That's not okay. And part of the way to address that is through mental health consultation. So I can already see that Mr. Wonderful and Mark Cuban are very interested, and all of you are very interested. So we'll keep moving to the next slide. The challenge is that we know that this is not something that everybody gets preparation for. Not everybody who's providing care has been adequately supported and trained over the years. Hopefully, many folks are, but we know that some are not, and that's why they need the support of somebody who has that mental health expertise. And that's what mental health consultation is. So let's keep going. So I always like to make believe that I actually know what I'm doing by putting in lots of words on a slide and making me feel really good about that I made a definition of something. But the truth is that this is important in the sense that mental health consultation, I know the mental health word gets people all agog, but it really is about the promotion prevention end of things. It's not treatment. It's a prevention-based approach. It's where we have somebody who has mental health expertise who is now going to work with folks in childcare who are providing care to help them know what to do to address social emotional development. Not just challenging behaviors or the kinds of difficulties that children may have, the trauma that we've talked about, the grief and loss, all those kinds of things, but to really actually just support all children in terms of their social emotional development. So it really is about equipping those childcare providers with the skills that they need. It's not about whether the mental health person knows stuff. They need to know stuff, and we'll talk about that. It's about how do we make sure that providers, that the educators in childcare, that they know how to address it, that they know how to support it, and they know what to do if things are not going the way that they think that they need to go. And then it focuses on that partnership and on equity, on this being a real partnership. It's not a mental health expert who just comes in and tells you what to do. It's that you're partnering with that person. Next slide. So here's the benefits. We've seen data that shows that it improves the individual child's social skills. It reduces those challenging behaviors, but it does so much more. It actually reduces provider stress, burnout, and turnover. For me, this is the thing. If we're trying to figure out what to do in our childcare field, what we're trying to do is make sure that people have what they need. They stay in their jobs. They are successful. We don't have all these transitions. I'm seeing it for my 5-year-old. Her teacher, she's been in this little hybrid model, which turned into a virtual model, which now has turned into that person's leaving. So this woman that she's been connected to, it's been her main connection during the pandemic, is now going to leave. And now I have a transition to deal with. And I'm just faking. I don't really know anything about mental health, so I don't really know what to do, but I'm just going to try and figure it out. But the truth is that if we can actually do these kinds of things within all the different varieties of childcare provision, what we're doing is we're providing a stable base for our providers, and we're giving a place where children's social emotional development is being addressed in the right way. Okay. So let's talk a little bit about this, because the question that comes up across the country, and this is happening, mental health consultation is happening in frontier and rural areas. It's happening within tribal nations. Folks in the Office of Head Start, Jen Oppenheim at SAMHSA, who funds the Center of Excellence, but also works with Project Launch and Indigenous Launch grantees. We are helping to develop this workforce across the country. So let's talk a little bit about the workforce. What we found is that it does require a certain expertise in mental health. So it's not anyone can do it. You need to have a consultant who knows mental health, who has the kinds of skills that are able to do this, including, and in some ways most importantly, ability to address equity issues. That's really where this intervention can be most helpful. And there's a whole host of other things, and I'll show you on the, I think on the next slide. So we can skip this one because it's super cute, but what we've come up with to sort of address that is the center has come up with a set of competencies, and those are available on the Center of Excellence website. They're actually aligned with the mental health competencies that the Alliance for the Advancement of Infant Mental Health has come up with, so that as folks within a state are trying to figure out what's our workforce, we're not trying to say there's a whole separate thing going on for mental health consultation. We're trying to say, how is this connected? How is it connected to everything that you've already heard? And how does it enhance it, not compete with it? So all joking aside that it's an episode of Shark Tank, it's not. It's quite the opposite. It's that if you think about the continuum of supports and services that you want to address social emotional learning, mental health consultation is one piece of it, as is the pyramid model, as is addressing trauma, all of these pieces. So next one. So I put this in here real quick because I do think that at a state, tribal, territorial level, what you want to be thinking about is, what are you trying to do? So how do we orient folks to, this is what our workforce and mental health consultation is all about? How do we build those skills? What's our approach? What's our sort of delivery model look like? And how do we support those folks and provide reflective supervision and ongoing professional development so that we build a workforce that's there for the folks in childcare so that they have access to highly qualified consultants. Okay. So generally at this point, when the investors get all excited, what they say is, yeah, but, so let me give you a little bit of the but so that you are ready to sort of figure out how to, you know, I always feel like, okay, so I have some money to spend on something with mental health or social emotional, what do I do? I think you should spend it on all of it, but here's a little bit of the evidence base. Next slide. So I've showed you these, and now let's talk about the fact that we have this evidence. We have some randomized control studies that have been done in Connecticut and in Ohio. They're working on this in Illinois. There are any number of people. If anyone's still on the call, I figure by the time they get to me, everybody just leaves. But there are any number of folks on here, and you'll see in the resource that Laura's going to talk about all the places across the country where this is happening. Some of it is statewide, some of it is more locally driven, some of it is through initiatives like Project Launch or some of the systemic care grants or other sorts of efforts, ECCS and other sorts of efforts that the federal government's been supporting. So let's keep going. Here's some of the measures. There's not gonna be a quiz at the end of this, and we actually have a choose and use guide if folks are trying to figure out, so what measures would we use? Our center's developed just a guide where you can just go in and say, this is what I'm trying to do. Which measure should I be thinking about? So we have all of those on the website. So, you know, as I said in the beginning, and I think you've heard over and over again, I love, Melody, as you talked about, you know, sort of the use of Indigenous language as an intervention, as an equity intervention, and about building resilience. We don't know a tremendous amount about equity, but what we're finding is that we actually are seeing some impact of mental health consultation on those folks who are providing care. And so we're starting to figure out that one of the things that mental health consultation does is it starts to address that implicit bias that Walter Gilliam always talks about. So that's one cool fact to share at your party tonight that you can't go to because we're all social distancing. So your party is just like this, a bunch of boxes on a computer. Okay, so let's talk about this with the pyramid model, because Lisa alluded to this, and I think it's important that this is not, you either do the pyramid model or you do consultation. You do both. And Lisa, quite frankly, has been one of the leaders across the country, along with Amy Hunter and others, in trying to figure out, how do we put all of this together? How do we have folks doing the pyramid model to fidelity? How do we have folks then also having access to a mental health consultant? They're pretty similar, right? We're really trying to figure out how to help children in those basic areas, positive relationships. How are we trying to build the capacity? Lisa mentioned the base of the pyramid is that effective workforce. Well, that's what mental health consultants do. We've seen this in childcare over and over again. How do we build up the skills of somebody who's a childcare provider? By helping them know the things that they need to know. Social emotional is one of the things that comes up over and over again. I have a slide that I sometimes show where we talk about children being ready for kindergarten. What do kindergarten teachers want? Want children who can problem solve, who can manage their emotions and sort of regulate their emotions, get along with other children, follow directions. Most children are going to eventually learn numbers, colors, shapes, things like that. But they have much more difficulty if they haven't mastered those social emotional developmental skills in their early years in childcare. So those goals are pretty similar, okay? What we've seen across the country is good examples in a number of places across the country where a mental health consultant and a pyramid model coach are working collaboratively within a childcare. Montana, in Bozeman, Montana, there's a great example. There's a great video, a little YouTube video that they've done, where they really are trying to help folks understand, we don't all go in and tell the provider something different. We all figure out what would be most helpful for this childcare, for this provider, and then we figure out who's best equipped to do it. Is it the pyramid model coach? Is it the consultant? Who is it that's going to go in and support? And what are the ways in which we don't duplicate services, but really complement one another? Okay, keep going, because this is really the big piece here for me, is that this is all operating in a system. So when we know that babies need high quality childcare, right? As somebody who's had 4 children, I've spent lots of money in childcare. The most important thing to me is, 1, I'm sending my child somewhere, and 2, it's got to be somebody who's going to love my child as much as I do. And that has to be high quality childcare. Mental health consultation can be something that really impacts the QRAS. It really impacts the quality of childcare. There are great initiatives where we're really tying those two things together in our system and having everybody in the system. I was just talking to somebody from New York State today who we're talking about. Everybody believes in mental health consultation, not just childcare, not just Head Start, not just behavioral health folks, but everybody, the folks in home visiting, folks everywhere, because it's in everyone's best interest that we have high quality childcare and that they have access to mental health consultants, because the home visitors may be working with the same family. The school system's eventually going to have that child. So we all are in this together. So keep going, because I'm sure I'm way over. I don't think it's shocking that somebody who is doing work at this level is going to tell you that partnerships are really important. We're in early childhood. It's all about relationships. These are the kinds of things that folks should be thinking about in terms of those connections and relationships. So yeah, thanks. So we know that it's those partnerships. It's about how you plan to provide that mental health consultation in concert with all the other sorts of social emotional supports that we've been talking about today, and that you figure out a way to pay for it. So I'm going to talk a little bit about how to pay for it. Oh, look at me. I didn't even know that was the next slide. All right, so folks have sort of thought, obviously we're here talking with all of you about this, but there are lots of different ways. And in some ways, it's really great news is there's not one single federal funding stream that, that pays for it. And then that's not such good news because there's not one federal funding stream. There's lots of different ways. So folks have used lots of different combinations of dollars to do this. And obviously some of these don't work in childcare. These are just examples. But we have sort of really good examples and we've written these up. They're on the website. Keep going, Laura. So here's the website. It's literally been updated today with a brand new set of resources. I think, I haven't checked it today, but supposed to be a brand new set of resources around research and evaluation pieces, around logic models and theory of change and things like that. All right. You with me, Laura? You should be trying to hustle me off the stage. What's happening? Yeah. So I just want to end by saying, you know, I said we're sort of on Shark Tank. I really want you to be a believer in this. And for me, there's not one thing that I've heard thus far that I'm like, well, I'd rather do mental health consultation. It's more, how do I incorporate mental health consultation, the role of mental health? And I'm going to keep saying it. I'm okay saying mental health. I get that there's stigma and things like that, but how do I incorporate that? So when you look at this resource that we've put together and come visit the website, we're happy to give TA. It's it's obviously what we're doing is working with states and tribes and territories across the country. We really view it as one component of your system. So I know I raced through it. I'm really sorry, and hopefully there's one nugget you got out of there, and somebody's ready to sort of say, oh, great, welcome to Shark Tank. That was a great show. So thanks, Laura.
Thanks, Neil. So again, remember that the PowerPoint slides will be made available to you all. We'll send them out to you. So if you have questions, you'll have people's contact information, you'll have the materials, and I'll talk more about additional resources. So we're really excited to have you join the panel today, because a lot of people are thinking about how they're going to use quality dollars perhaps to pay for some of this. And maybe if there are other dollars that come to them, how would they leverage those? So I'd love to turn it over to you.
Sure, great. Thank you, Laura. I'm Andrew Williams. I'm the Division Director for the Planning, Data, and Policy Division in the Office of Child Care. And as Laura said, I'm just going to take a minute to quickly talk about how you might pay for this, other than, in addition to going on Shark Tank. And specifically, how can CCDF funds be used to support these types of initiatives? So first, just a reminder, states, territories, and tribes have to spend specific amounts of CCDF funds on quality improvement activities. And for fiscal year 2020 and going forward, states and territories must spend 9% on quality and an additional 3% on infant and toddler quality, for a total of 12%. And you can see the requirements for tribal lead agencies here on the slide. In addition to regular CCDF funding, The $3.5 billion in supplemental CCDF CARES Act funds that were awarded earlier this year can also be spent for quality improvement activities, as long as they are connected to preventing, preparing for, and responding to the impacts of COVID-19, which can include mental health impacts. And as Shannon said at the beginning of the webinar, Congress is currently considering additional COVID relief funding, and this may include resources for childcare to stabilize the childcare market and to meet the needs growing out of the pandemic. And many of the bills that we've seen focus on funding for states, territories, and tribes to provide stabilization grants to childcare providers for a wide range of costs associated with COVID impacts. And a bipartisan Senate bill that was introduced yesterday specifically mentions that these grants, among other uses, can be used for mental health services and supports for children and employees working in childcare. The bill also includes funding for states, territories, and tribes to administer these grants, including to provide technical assistance, outreach, and support to childcare providers. So we'll obviously be watching closely about what happens with those bills, and we may know more the next few days, and we'll keep everyone posted. Next slide, please. So turning now, going back to the current CCDF and digging down a bit further, we wanted to talk specifically about allowable quality activities. And these are discussed in more detail in the regulation in section 98.53. But on the slide here, you can see the buckets or the categories of quality spending that are mentioned in the regulation. And the regulation specifically and discusses how they can be used to promote social and emotional well-being. And this includes training and professional development for caregivers, teachers, and directors on strategies to promote social and emotional development of children, behavioral management strategies and training that promote positive social and emotional development and reduce challenging behaviors, development and implementation of early learning and development guidelines to enhance the domains of child development, including social and emotional development, developing or adopting high quality program standards, which include standards related to mental health, and as you can see here at the bottom, other activities for which measurement of outcomes is possible, related to improvement of provider preparedness and child well-being. So there is a great deal of flexibility in the use of CCDF quality dollars, as long as the goal is to improve the quality of non-parental child care. And activities that support the social and emotional health of children in childcare are clearly allowable uses of CCDF. If this spills over into coaching and supporting teachers and caregivers in ways that touch on their own social and emotional health, this is okay, as long as the state, territory, or tribe can make a logical connection between what it is doing and improving the quality of childcare. And research and experience suggests that caregivers need to be in a good place themselves in order to support children's learning and development. In terms of any services for parents, there must be a connection to non-parental childcare in order for this to be an allowable use of CCDF. So standalone services for parents, such as standalone home visiting, parenting classes, or mental health services would not be allowable uses of CCDF if they are not connected to non-parental childcare services. But on the other hand, activities that help parents engage in non-parental childcare services are allowable. And these could include mental health supports or referrals if the goal is to improve the quality of childcare. So that's a quick summary of what's allowable under CCDF. And with that, I'll turn it back over to Laura.
Thank you so much, Andrew. And I think it's really important that if you're thinking about this and you're thinking about the dollars and you have questions, please make sure your questions get elevated to your regional office. And they, of course, be standing by to support you. When you get into these intricate details of policy and expenditures, you should just never hesitate to ask. And of course, going up to your regional office is the most direct way to the answers around these policy funding questions. So thanks, Andrew, for being with us. So I want to ask 2 more poll questions, and I want to ask people to start putting in the chat box some of your questions. So our first poll question, and if you want Patrick to go ahead and launch those, is, so given what you've just heard, an hour and a half of some, I think, exciting strategies that kind of help us move the needle for our young children, where is your state, territory, or tribe in thinking about this work? Are you excited to start exploring? Are you already engaged in planning, but maybe could use a little support? Are you piloting an initiative? Are you partially implementing an initiative already? Or are you a state that is fully implementing a social emotional wellness strategy? And then our second poll question is, are you interested in receiving technical assistance or joining a community of practice related to one of these models? And again, we're talking about the pyramid model, the infant early childhood mental health model, relationship-based care training for trainers, and school-age implementation models. And as we're having people throw up their answers, I want to say a quick second about this second question about receiving technical assistance. I hope everyone on the call can access their state administrator, and maybe we have a lot of administrators on the call, but your state system specialist is just the critical lever for you to access technical assistance on any of these topics. And so if you're sitting in your chair and thinking about, man, we really want to do this, and you're not a state administrator, you could talk to your state administrator and say, hey, I think maybe we have the capacity as an infant toddler specialist network, perhaps, to really help you implement this. What happens next is the state administrator talks to their regional office, who gets in touch with our state administrators, and those state administrators are really awesome at connecting you to the right national center to support your free technical assistance and connecting you to our group activities. So again, you can reach out to any of us if you have questions about accessing technical assistance, but you can also reach out directly to your state system specialist who's ready to help. I'm going to end this polling. We have about half of it answering. And it looks like we have about 45% of you who are partially implementing, about 6% piloting, 15% are getting ready to start exploring. So that's really great numbers. And it also looks like in the poll that we have a lot of interest in the pyramid model, 49%, and 57% interested in the mental health consultation. So Neil, you did a very good job of selling. So I'm telling you, Rana, they're coming at your technical assistance team to get this relationship-based training for trainers. And Qatari is excited to see that 17 people have said, hey, we want to talk more about school-age implementation. So thank you, everybody, for answering those poll questions as we try to get more information about your needs. So let me talk a little about what's coming soon. So after this webinar, next week, you'll receive a copy of this PowerPoint, and then you'll also receive links to a series of resources. So we wanted to put together a guide that would help you start thinking about these initiatives, answer some of your initial questions, and provide a lot of resources. But we didn't want this to be too overwhelming. So we're going to chunk it up a little bit and provide you with a series of resources. One that is really focused in on implementing just basic strategies, a nice brief about the pyramid model, a really good brief about infant early childhood mental health, Rana put together a nice brief on her training for trainers. Katari also did a great job of putting together some resources and information about school age care. And then we have a nice 2-pager that just reinforces the acceptable use of your quality dollars. So those resources will be available to you in addition to really great landscape of both pyramid model implementation and infant early childhood mental health implementation. So you can look at these landscapes and say, oh, my neighboring state is already fully implementing, and here's the person I contact to get more information. So you're going to get 2 really great landscapes, both mental health consultation and about the pyramid approach. So you're also going to get a ton of just resources on both infant toddler mental health consultation, infant early childhood mental health conversation, and then also just some general resources around social emotional wellness. So we're going to flood you with the resources that you need to get started on this conversation or to further your development. And we expect to have those ready for you next week, and we'll send them out to you along with a follow-up email. So we want to engage in some questions, and I know that Melody has been looking at some of the questions in the chat box. And as she's looking at those questions, I can also say to you that it will be really important that you engage with us in ongoing conversations after this webinar. And so here is our each of our contact information. Again, you can reach out to the Quality Assurance Center to support joining community of practice, or helping you think about a needs assessment to where your state might be going. You've got NCASE's email address. Neil is at the National Health, Behavioral Health and Safety, and at the Center of Excellence. You can reach out to Melody at the Tribal Center. You can reach directly out to Lisa. So really, whatever door you go through for technical assistance, we will make sure that you then follow all the protocols to get an approved request, and so we can follow up with you. So Melody, any questions in the chat box?
Yeah, we have a couple questions. It looks like, so someone asked, is there a way to have this presentation in Spanish for family child care? And Rana answered that we can work on getting this information translated to Spanish. Someone also asked if they'll be receiving a certificate of attendance.
And we did not do certificates of attendance for this particular webinar, Melody, so I'll go ahead and answer that. But we did have an earlier question before the webinar about Spanish translation. And if you have a need to have us deliver this presentation in Spanish, we will work with our partners. We have 2 great partners as part of the Technical Assistance Network who can help provide that. So we'll work on that immediately.
Wonderful. And then we do have a question from Stacy who asks, can those activities be tied to states' Medicaid supports for children and adult mental health care? And it sounds like that might have been a part of Neil's presentation. So not sure if Neil saw that question.
I was so busy racing through my slides. Yeah, I saw it. So it sounds like it's not. I think it's much more important that smart people like Andy reply to those questions.
Hi. Yeah, I don't know the answer to the question, so we can look into that and get back to folks.
Great, thank you. And there is one more question that just popped up. On any news on 2021, it says teapot training. I'm assuming that means the teaching pyramid observation tool training. And maybe that's Lisa?
Yeah, it's probably for me, and I don't know, it might be the teapot training that occurs at our National Training Institute in spring. We're canceling the 2021. April's just too soon. Teapot training always could be available through Paul Brooks or Pyramid Model Consortium. So if you want to reach out to me, I can help you connect to the right person to arrange to make that happen.
Thank you, Lisa. And it looks like there are a couple of other questions coming in. Good questions, everyone. Any conversations about increasing salaries for childcare providers? And that might be a general question, but possibly alluding to maybe what Andrew and Shannon had shared. Not sure.
And maybe I'll just generally say that at the Quality Center, we bring together a lot of communities of practice, and on several of them, they're talking about what are some of the states doing around compensation for early care education professionals. And so if there is a need for us to convene a group to be talking about strategies that states are using around that, I think that's something we can certainly talk about, but we do recognize that especially now, making sure that a living wage is really critically important.
Can I say one thing, Laura?
Please.
You know, looking at wages and compensation, the bigger package of benefits is a really big deal. And when we held a series of listening sessions around the country last fall, that came up time and again. And I think what is important to know is that it's up to the states to set up their subsidy reimbursement system, and then the subsidized providers are actually only a small portion of all providers. At least 2/3 of this is in the private sector. So part of what we have to do to increase wages is to increase everybody's understanding that quality childcare is a part of a strong economy, as part of children's overall success and ability to become the kind of adults that contribute to society, and that we all have skin in this game, whether there are children or not. And I think what's been sort of interesting about watching what's happened through the pandemic is there is so much more awareness of the fact that childcare is part of a working economy and that we have to address it. And if we can't hang on to teachers that are good, we're not going to be okay. And I think that we have to just do a really good job of helping people understand this so that states and tribes and territories make the decisions that they can. At the same time, we are part of our law for the CCDF, for the subsidized families, is to hold the systems accountable for equal access, which means that subsidized kids should have access to the same range of choices that unsubsidized parents have. And if their set of choices is too small, they're not really providing equal access, we will be in a position to eventually fine them. We would have been doing it now, but when the pandemic came along and everything got all, messed up, it decided this is not the time to get serious about that. But it will happen as we come out of the pandemic, if we have to in certain states, to try to get the rates up at least amongst the subsidized families. And the other thing is, during the pandemic, all of the rules that we have allow sort of hardship wages to be paid, and an increase in the provider reimbursement rates to try to supplement that income. And then if we do get this stabilization money that Andrew was talking about and that I mentioned earlier from Congress, that money can help pay for higher wages and benefits if that is what the state chooses to do with it, to try to help childcare providers, subsidized and unsubsidized, survive this pandemic. And then the question will be, what happens when that money goes away? How do we keep it going? But there are ways to do it. It's complicated, but it's really important. So thanks for asking the question. I don't know if Andrew wants to add anything.
No, I think you covered it. I mean, the stabilization bills do specifically mention the reimbursement and payments to staff. So it is on people's radar screen.
Well, thank you for that. Well, it is coming to the top of the hour. We want to thank all of you for joining us. I know that you're going to get a link to an evaluation so we can get some feedback on this webinar. We want to encourage you to reach out to us for support. We will preemptively reach out to you to ask what we can do to follow up with you and your team. Don't hesitate to use these email addresses to reach out to each of us. And you will receive an email from us next week with all of the materials, and then a prompt for you to ask for assistance. Again, the National TA Center Network is really standing by to make sure that you have a successful launch. Also, if you're interested in on a small work group to really think through some of the ways to most effectively support your needs, don't hesitate to reach out to the Quality Assurance Center at ecetta.info. That's where you can reach me. I'm the project director of the Quality Assurance Center. And I'll be gathering some names so that we can form a small work group to work with Shannon to really dig a little bit deeper into your needs and supports. So I really want to encourage people who want to be thought partners with all of us to reach out. So thank you to everyone. Thank you, Patty, for encouraging people to fill out the evaluation so that we can get some feedback from you. And we will keep up with you and touch base with you again next week. So thank you, everyone. Shannon, any last words?
Just thank you for hosting this and all of you that worked so hard to put the presentation together. I think you shared a lot of information in a short period of time in a very clear way, and I'm excited to see what we can do next. So thank you, and thank everyone for sticking with us. Thank you.
Appreciate you.